So when a patient sends in an inquiry, whether it's going to be an email, a DM, or calls the office and asks surgical questions, what they're first going to do is get in contact with Lindsay. She is my patient care coordinator. She's going to give you a call. She can answer any questions you have. She can discuss even price ranges for the surgical procedures you're interested in. She can explain downtime, preoperative care, postoperative care, what kind of resources we have available for patients that come from inside town, out of town, all of that. So she's a really good resource. Once you've talked to Lindsay and gotten a general idea of what my practice is like, what the surgical journey would be like, she can help you get onto my schedule for a consultation. We have both virtual and in-person consultations available. For an in-person consultation, you'll come into the office, you'll meet with Lindsay. She goes over all of your history, any medical history, medications, all of the really important stuff, because this is a surgical procedure. I am a doctor. It's really important that we're doing this under the safest circumstances possible. After that, she gets pictures, and I like pictures from all different angles, smiling, not smiling, dynamic, bending forward, raising, all of the things. After that, you get to come into my office. I do a really good physical exam. We then pull your pictures up onto my computer, and then we're able to look at them together. We can discuss what you like, what you don't like, what your general overall goals are, and that really helps narrow down what our operative plan will be. So once we've come up with a surgical plan that we all agree on, that we're really excited about, what I do is I write it down for you. I give you an itemized list of what all of my recommendations are, and I really find that that helps patients process the information. There's just so much information coming in during one of these consultations that it can be overwhelming, and that's the last thing that we want. So I write everything down, I print it out, and you have that in your hand to kind of process and think about when we're done with our consultation.